Hi, I'm Dr. David Prince at Montefiore Medical Center in New York City. And today I'm going to be sharing with you some of the tips and tricks that I've learned over the past couple of weeks as I've had to convert our practice from a clinic-based practice to a virtual practice. So there's 3 sections that I'm going to go over. The first one is camera basics, or how to set up your environment so it's optimized for a video visit. Vetiquette, or video etiquette, so that you can connect with the patient comfortably and make them feel at ease. And the last one is what I call doctor stuff. Just a couple of ideas about how I document my notes, and I think it'll be helpful to anyone, any provider, no matter what their discipline is. So let's get started. The first section, camera basics, the most important thing that I want to share is to look at your environment, set up your camera, and see if there's anything that potentially would have any HIPAA protected information on it. It's not likely to be on the walls or in the background, but maybe on a flat surface on a desk. You might have some papers, or if you're filming your screen or for some reason sharing your screen, you have to be very careful to make sure there aren't any other patient protected information on it. So just be mindful of that, because that's really not something you want to do by accident. Be aware that if you don't have good lighting, that you might need to supplement that. Reflections, keep an eye out for those. At some angles, you'll see reflections in some of the diplomas in the background, so I can just block those with my head or turn the camera so that it doesn't distract the patient. You have to play around with your individual setup to see what looks the most natural for you. It might look like I'm looking directly at the camera. I'm actually looking in the middle of my screen. And I found the easiest way to find out where your eyes are is just put your finger and say out loud, I'm looking in the middle, I'm looking to the left, I'm looking here, and actually look at your finger, and then you'll be able to determine from that where you should be looking in that video setup to give the right angle that you want to achieve. In terms of props or things to help you during your visit, I have over here some hearts. I'll often explain stuff. If there's anything that you're going to use, whether it's a chart, an RPE chart, or an anatomical model, or something that you want to show them, have it available on your desk before you start, so you don't have to turn your back to the camera and be searching around for things. That's kind of distracting. I also use a big book, I'm going to show you, for my laptop, because I think that the higher angle, so I have it's a pretty big book, it's about 2.5 inches, and then what I do is I put the laptop on top like that, because what it does is it allows a little bit more of a direct on view, similar to like what we're seeing here, but it allows the laptop, it kind of avoids that viewing up that you see so commonly. I don't think it's a big deal, but it feels a little more natural. So you want the patient to feel like you're making a house call, not like they're attending a meeting online. In terms of audio, just be mindful and don't be shy if you need to tell people in your working environment that you are doing a video call. I use earbuds because it helps me hear better. But I also have started putting a sign like this on the outside of the door that says, "Quiet please, video visit in progress." And when people see it, they'll often kind of like bring the volume down. So that's my first section, camera basics. And we can move on to vetiquette, or how to interact with your patients online. So this is what it looks like when I'm in a video visit. And the first thing to do when we're talking about vetiquette or video etiquette is obviously introduce yourself. Introduce yourself and take advantage of the fact that you have a camera to introduce your environment. If your patient was here with you in your office, they'd be looking around and seeing what's around. You don't have to give them a tour, but you can say, "Welcome to my office," so that they have a little bit more of a feeling of being there with you. I actually smile and wave. I wouldn't do that normally with a patient in my office, but in this venue it seems appropriate and people seem to really like it. They smile and wave back, and I think it's helpful to just kind of break the ice, especially if the person has been trying to connect or dealing with any frustrations around the technology, then it's a nice way to kind of welcome them to the visit. First things after you introduce yourself is ask them about their audio and video connection. Can you hear me? Can you see me? And let them know if there's any problems, please let me know. We can switch to a telephone call if we need to. With the platform that we use at Montefiore, I can actually call the patient and it will not disturb the video feed at all. So if I'm having trouble with the audio, but the video is okay, I'll tell them, just mute your audio and I will call you on the phone. You can call them either on that phone or someone else's phone or a landline if they have it, but it's important that they not find the experience frustrating. So check in with them before you start and give them permission to interrupt you if anything changes. Explain the setup of your office, meaning I tell them I'm looking at you here and your chart is over here. So when you see me looking over here, that's because I'm documenting in your chart. Sometimes I'll actually pick up the laptop and show them. Tell them ahead of time if you want them to do something or demonstrate something for you or bring information to the visit for you so that they're prepared just the way you're prepared. So in my practice, I'll ask them to put the phone on the shelf where they can see a chair, and I want to see them get up and stand up and sit down from a chair, because that gives me information about their balance and how they're walking, and that's helpful for me. So those are my tips for etiquette or video etiquette, how to connect with someone for the first time in a video visit. And so let's talk about some doctor stuff. So the last section I want to talk about is a couple of things I call doctor stuff, mainly related to documentation. So when I document a video visit, I will actually ask the patient to demonstrate parts of the physical exam that are useful for me. I work in rehab, so for me it's very important to see range of motion and how the patient's moving in three-dimensional space. So I'll actually ask them, can you raise your hand, touch the back of your head, in order to check the joints that I'm interested in based on the history. And I will actually write observed physical examination in my note. You can also ask the patient to report their vitals to you. If they have a blood pressure cuff, a lot of our patients do, then you can have them take it right there on the spot. I did that just this morning. And then you can talk about the results with them or use that to guide your exercise guidance. So that's something that's pretty easy a lot of our patients can do. Ask them if they have any questions about the format that you're using, the actual video technology. Get their input on that and see if they're comfortable with that, if they have any questions about that. One of the things that occurred to me was patients may think that they're being videotaped while you're doing these visits, which of course they're not, but they might have concerns about that, or who knows what they think about it unless you ask them. And the last section is ask them if they want to have another video visit, or they prefer telephone, or they want to wait until an in-person visit. And if they're more comfortable, then you're going to get a better history and they're going to have a better experience. So those are some of the ideas and tips that I've learned over the past couple of weeks. I hope they're helpful for you, and I would encourage everyone to explore video visits if you haven't already, because they're much more meaningful than a telephone visit. And I think it's more like a house call than checking up on patients on the phone. It's given me a lot more information, and I think a better connection to the patients, which everyone needs right now because everyone's extra isolated at home. So I hope that's helpful, and I'm open as always to feedback, suggestions. You can just email me. Thanks a lot.